We are on MCA TV and this is the second edition of the jENS Congress, and we're here with Professor Luca Ramenghi.
Good morning.
Good morning. Professor, can you tell us something about UGR in neonatal care?
Right. Intrauterine growth retardation, first of all, is a condition that is really obliging us to work together with the obstetricians. So the first aim is to understand when it is better to have the baby delivered and in which way. So I think this is a very important issue because it is crucial for collaboration between these two entities that are neonatologists from one side and obstetrician or fetal doctors from the other sides. So it is a combination of clinical decisions based on sixth sense as well, and a lot of data about the flow in the fetus, how it's adapting to that kind of sufferance because of reduced nutrition, reduced blood flow to the entire fetus. This is the first part of the problem, and the second part of the problem is how to provide neonatal care later on these babies. And this is very dependent on the gestational age. So you can have even a term baby who has been suffering intrauterine growth retardation, and for our brain and our minds is something like, well, was he small and little from the beginning, or it was later on that the fetus was not growing so well. So this is very different in the way of even following the baby's heart to see what's going on in the rest of the life. As I told you, I mean, as neonatal care, we have to be sure that the baby is fine. How to nourish the baby is a crucial point, especially for the meaning of epigenetics, the importance of the first 1,000 days of life. That means the environment starts to affect the baby and the fetus inside the womb of the mother. And so we have to be very careful even not to overfeed the baby in order to fill the gap. So we have to, and in that way the medicine has changed a lot. So I think it's a very important issue, especially in the identity of perinatal medicine, thinking that perinatal medicine is joining two different entities, obstetrician, fetal doctors, and neonatologists.
Thank you, Professor.
My pleasure.